be your student nurse for today.
Okay.
I'm going to go ahead and give you some privacy.
All right.
Okay, and can you please state your name and date of birth?
My name is Blake Bloworth, and my date of birth is 0225-2000.
Okay. And are you having any pain today?
I've been having like a cramp in my left calf muscle.
Okay, and if you had to rate that pain on a scale of 1 to 10, what would you rate it?
Like a 4 or 5.
4 or 5? Okay, and what's the quality of that pain? Is it like a stabbing pain, or what type of pain do you feel?
It's like a sore cramp.
Sore cramp feel? Okay. And when did this start occurring?
Like 2 or 3 days ago.
2 or 3 days ago? Okay. And when do you feel like it hurts the worst? Like, what do you do that hurts the worst? It makes it hurt the worst.
Walking makes it hurt.
Okay. And what can you do that makes it feel better?
Like sit down or lay down, just rest.
Okay. And is it only in your calf, or is it radiate anywhere else?
Yeah, it's only in my calf.
Only in your calf?
Mm-hmm.
Okay. And your doctor ordered to take your vital signs today, so I'm gonna go ahead and do that. That's fine with you.
Okay, that's fine.
Okay. I'm gonna go ahead and take your pulse.
Okay.
Just relax. Okay, and your pulse was 60, your respirations were 20, which is normal.
Yeah.
I'm gonna go ahead and take your blood pressure. Do you know what your normal blood pressure usually is?
It's like 120/80.
120/80. Okay, and do you care which arm I use?
Either one's fine.
Okay, I'm gonna go ahead and use your right arm. Can you please pull your sleeve up? Okay. We go ahead and check for the brachial pulse. Okay. Okay, I'm going to put this on the shirt.
All right.
And is that too tight?
That's fine.
Okay. Okay, and your pulse is 120/82, which is in the normal range.
Okay.
Okay, and I'm going to go ahead and listen to your heart sounds.
Okay.
Okay, I'm going to go ahead and go to the aorta. The pulmonary, the Erb's point, tricuspid, and mitral valve. Okay, and all sounds good. I'm going to go ahead and listen to your lung sounds while I'm here.
Okay.
And every time my stethoscope touches your body, can you please take a big deep breath in?
Sure.
Okay, I'm going to go ahead and go up at the right upper lobe. left upper lobe. Again. Okay, right. Okay, right lower lobe. And left lower lobe. Okay, it all sounds good. And if you did have any abnormal sounds, I would use the bell to be able to listen closely.
Okay.
Okay, I'm gonna go ahead and get you to get a 45-degree angle. Okay, and I'm gonna get you to turn your head this way. And I'm looking for any jungular indication. So there's none right there. And then also none right here either. And then these right here are your carotid pulses.
Okay.
And then right here under your armpit is your axillary pulse. And then right here on each arm right here is your brachial. And then these two are your radial. So I'm gonna go ahead and feel for these. Okay, I would say it's a +2. Okay, I would also say this is a +2. And while I'm here, I'm going to do your capillary fills. Okay, that looks good. I'm going to go ahead and check for edemas. Okay, looks good. And then this is your femoral pulse. And then right here behind your knee is your popliteal.
Okay.
And I'm gonna go down here. This is your tibial. I'm gonna feel for these. I would say that's a +3. And over this one. I would say it's a +2, still really strong. Okay, I'm gonna do dorsal pedis. Okay, I would say that's a +2. And then this one I would do a +1. It's weak, but you can still feel it. So that's good. I'm gonna go ahead and check for edemas also. Oh, I'm sorry about that.
You're good.
Okay, and that all looks good.
Okay.
So are you having any heart problems or respiratory problems?
I don't think so.
You have any trouble breathing lately? Or do you feel like your heart's beating out of your chest? Okay, and I'm gonna go ahead and turn you around.
Okay.
Okay. And then if you can you lean up for me?
All right.
I'm gonna listen for your lung sounds again. And every time my stethoscope touches you, take a big deep breath in.
Okay.
Okay, this is your left upper lobe. Okay, your right upper lobe. Left lower lobe. Left lower lobe. Okay, and all sounds good. And also, again, if I did hear anything abnormal, I would use the bell.
Okay.
Okay, go ahead and sit up. Okay, you can sit down. And then can you please cough for me?
Sure.
Okay, that's a little dry, but it's okay. And you didn't have any sputum that came out, so that's awesome. And I do want to recommend to do deep breathing techniques. So, take a deep breath in, hold it for a couple seconds, and then breathe out. It does help you with your lung expansion in your chest, so that's awesome. And I'm going to show you about this insensitive speedometer.
Okay.
So it has a tip at the end. You put this in your mouth, and you take a big deep breath in, and then you hold it for 5 seconds or however long you want to. And I'm going to go ahead and show you. These are the ticks on the thing, and the doctor's going to prescribe for how long you want to hold it and to get to. And then you just let go of your air. And you do this 10 times every hour that you are awake.
Okay.
And this helps with lung expansion and controlled breathing.
Okay.
So go ahead and do that. And then that's all. So I'm gonna go ahead and put this in the document, and then your doctor will be in here in any second.
Okay. Sounds good.